Hey everyone, it's Joe here. Hope everyone is staying safe and hopefully everyone is practicing social distancing. Today, I actually just want to make a quick short video. I wanted to give a quick synopsis of this coronavirus. I wanted to give a quick disease process of this disease process, the coronavirus. So hopefully, I'm gonna keep this under 10 minutes. Hopefully, it works out. Here we go, real quick. I'm going to try to explain why people that get infected by this virus cough, have a temperature, and have pneumonia. We all know from what we've been hearing, there's a lot that we don't know about this virus yet, but we know enough at this point. We know it's a respiratory illness. This coronavirus, you've seen how it look under a microscope. Those spikes that you see are actually protein. They're protein spikes. This is how it actually gets into our lungs. Maybe you touch your face, you touch your nose, and you get infected by this virus. This virus makes its way through the trachea, also you can call it a windpipe. It gets inside. The way it actually gets into our lungs, real quick, is through this ACE receptor. ACE receptor is an acronym. It's actually angiotensin converting enzyme. You probably heard of ACE inhibitors and stuff like that. People that have high blood pressure, this is why this virus is so dangerous for them, because this virus basically has a key to get into our lungs because it attaches itself to this ACE receptor. The ACE receptor is like a key, is like a doorway that this virus has a key for. This virus basically attaches to this. This opens up, and this is how the virus actually gets into our lung. It basically attaches itself to the ACE receptor and gets engulfed into our lungs. Once it's in our lungs, we have two of them, two lungs. It goes to where the lower part of our lungs, there's this thing called the alveoli in our lungs. They're little air pockets. They're little air pockets. There's a bunch of them in our lungs. This is where gas exchange takes place. You breathe in, you breathe out. Alveoli, this air pockets, is where gas exchange takes place. This virus attacks that. It attacks a cell inside our alveoli, which is the type 2 cell. Type 2 cell, real quick, produces something we call a surfactant. I'm not going to get into that today. Produces something we call a surfactant. Before I go any further, why do people that get infected by this virus cough? Because once this virus attaches itself to this ACE receptor, the ACE receptor is a whole process to it. Nurses will know what I'm talking about. There's a so angiotensin converting enzyme. There's this process which leads to regulation of blood pressure and all that. There's this process, angiotensin 1 turns into 2. Once this virus attaches itself to that, it stops the process, stops it. So now you can't regulate your blood pressure. This is why it's so dangerous for people that have high blood pressure. It stops that process. With that process being stopped by this virus because it attaches to the ACE receptor, there's a buildup of this molecule called bradykinin. The accumulation of bradykinin leads to dry cough. This is basically dry cough. That's what leads to the accumulation of this bradykinin leads to dry cough. With this virus, what we know is that some people are asymptomatic, some people get cough, temperature, and then pneumonia. We're gonna get into that. Once this virus attacks our type 2 cell in our air pockets are also called the alveoli. We have a bunch of them. When it attacks that, it kills that cell, kills the type 2 cell, kills it. Once the body senses that something there's a death, something died in our body, there's an immune response. With the immune response comes inflammation. Inflammatory response follows that. The reason you get a temperature is because with this inflammatory response comes, like in collection, comes this thing called interleukin 1 and interleukin 6. With this interleukin 1 and 6 being released, there's a part of your brain that picks that up, which is called the hypothalamus. Hypothalamus picks this up, and the brain senses this interleukin being released, and the hypothalamus will increase your temperature in your body. This is why you have a temperature, because of the release of the inflammation, and the immune system response releases interleukin 1 and 6, you get a temperature. For some people, they get a temperature, they have a fever, they're okay after about 2 to 3 weeks range, right? Where it gets worse is when it leads to pneumonia. What is pneumonia? Pneumonia is basically when the type 2 cell in our lungs, the air pockets, gets an immune response. With this immune response, like I said, leads to inflammation. Inflammation is basically water. When you hit your knee on the heart like a table, that area gets swollen. That is inflammation. Basically water. So inflammation starts to happen in our lungs. Basically water in our lungs because of this immune response from a cell dying in the lungs. So there's all this water in our lungs. With the water now leaks into the alveoli. This alveoli. The water leaks into that. All the water that's going to our lungs from the inflammation now leaks into our lungs, into our alveoli. Like I said before, the alveoli is where there's gas exchange. Breathe in, breathe out. When there's water in your alveoli, the definition of that is called pneumonia. When pneumonia leads to ARDS, acute respiratory distress syndrome. This is what's putting people on a ventilator. This is the virus gives a very, very bad case of pneumonia. Leads to ARDS. ARDS, if you want to look at it, it's like the lungs get stiff. It gets stiff. Before you're able to breathe like this, when you get a stiff lung with the ARDS, now you can only do this. You can't take that deep breath because your lungs has become so hardened from the water and all the damages that's going on. This is why unfortunately people are dying. When you get this ARDS, when you get this pneumonia, you present to the hospital, you come to the hospital and say you can't breathe. This is when you can't breathe. People are basically drowning from within because there's water in their lungs and their alveoli. When you present like that, the doctor, the nurses, or respiratory therapists, I'm a respiratory therapist, will give you oxygen to help with the breathing. If it gets worse, that you still can't breathe on your own, we intubate you and we connect you to a mechanical ventilator. Respiratory therapists are pros at managing this ventilator. We're pros at managing this ventilator. When you get intubated, you get connected to this ventilator. We're basically breathing for you. We're breathing for you because it's hard for you to breathe because of this pneumonia. Unfortunate part is that when you get intubated and you're connected to a ventilator, there's a 50% chance of survival. 50% chance of survival. It's a horrible disease. Don't play with it. It's a horrible, horrible disease. Me personally, I'm being in healthcare, I'm being a respiratory therapist, I'm going through this motion of seeing my colleague become my patient, and some of them dying from this virus. It's messing me up, but we will get through it. We will get through it. Hopefully I'm able to give you a quick synopsis of what the disease process looks like. There's a lot more to this. This is just for educational purposes, and I hope you learn a thing or two from this. Let me see if I'm missing anything. Again, thank you for watching. Practice social distancing. For the most important thing you could do is actually wash your hands. Wash your hands. Thanks again. Stay safe.